people don't realize just how important a primary care physician is until something goes wrong or something out of the norm arises. Primary care physicians are your first line of defense when new symptoms arise. Today, we're going to dive into just how important primary care physicians are, how to find a perfect one for you, and answer your questions here on Ask the Doc. No appointment needed.
Funding for this program is brought to you by Michael J. Zinner, MD.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage you, our viewers, to send us your healthcare related questions. My name is Dr. Kamaljit Kaur, and I'm a double board certified primary care physician here in South Florida. Let's get right to our questions. The first one comes to us from Lincoln, and Lincoln writes in to us from allhealthtv.com asking, "Hi, Dr. K. I just got married, and now my wife wants me to find myself a primary care physician. I want to know what's so important about me finding one." This is a great question. Firstly, congratulations, Lincoln. I hope you guys have a happy and healthy married life. And yes, she is absolutely right to encourage you to find a PCP. You should have a PCP for so many reasons, but primarily because we help take care of your whole health, not just when you have a cough or a cold. Unlike what many people may believe, primary care is not only for when you're sick and need antibiotics or other short term medications. A primary care physician is trained to look for many different health problems. They can check how your body is doing and help catch disease early, which is so important because the best treatment is prevention, totally, or even catching things early so they don't progress. Your primary care doctor knows how to do this well. And your primary care physician also helps when you need to get other healthcare services. Your PCP is there to help you navigate this chaotic healthcare system that we have. So if you need to see a doctor or a specialist or go get an x-ray or go get blood work done, it is really your PCP's responsibility to help navigate where you should go, when you should go, and questions like that so they can really take care of your entire health. Now, specialty physicians focus on one or two parts of your body and your systems, maybe the skin, like a dermatologist, or the heart, like a cardiologist. But a primary care physician needs to know about all of the systems of your body, and most importantly, how they all interact with each other because everything is connected. It's kind of like a whole piping system in there. One thing goes wrong and it definitely affects something else, at least to some degree. So a PCP knows how to recognize or to look for connecting the dots. If you come in with certain symptoms and they seem to be unrelated, maybe you're having a headache and a skin rash at the same time. Now, these are two different body systems, but your PCP will sit down and ask you a series of questions to really start investigating and maybe connect the dots to see where we can get. Maybe this is a pattern of diseases that's characteristic for one particular condition over another. And a primary care physician is going to help figure that out for you. Most importantly, a primary care physician should be someone with whom you have a good relationship, somebody that you're comfortable with, that you can share your symptoms with. Most of the time, our symptoms are pretty self-explanatory or easy to explain, but sometimes there are certain things that may occur with our health that we are a little shy to talk about, or we feel nervous talking about them because they might be scary. So you want a PCP with whom you're comfortable. You can go into their office and you sit in that exam room and you chat with the doctor and you're open enough, or you feel you can be open enough to tell them everything that's going on with you. Because honestly, we want to know it all so we can best help connect those dots and take care of you. I hope that answered your question. Let's get to the next one. This is from Lucia, and Lucia reached out to us through YouTube asking, "Hola, Dr. Kaur, quick question for you. Is a primary care physician really necessary in the age of urgent care and telemedicine? Oh, this is a very wonderful question and one that I have so many thoughts on. So I'm going to try to organize them as best as I can. Let me start by asking you a question. When you're sick, whether it's a cough, a cold, a skin rash, a urinary infection, or a bellyache, anything that's not making you feel well, who do you want taking care of you? Someone who you've never probably met before and really doesn't know your health or your the details surrounding your health and what impacts your health, or do you want to have this investigated by a physician who really knows you, knows your health history, knows your preferences, whether that's cultural preferences or just, the way you like to do things when it comes to your own health care? I think it would be the latter, no? Having care done by someone who knows you well and knows your medical history is not only more comforting, like I was talking about, because you can talk to that person, you can talk to that physician openly about what's going on, but it also minimizes the risk of medical errors and optimizes our treatment plans as well. While urgent cares and telemedicine are great alternatives for when you don't have that access to a reliable primary care physician, they're no substitutes for your PCP who knows you and your health best. For example, say you have a cough or sore throat and you decide to go to your urgent care instead of going to a PCP, or unfortunately, maybe you don't have access to a PCP. If you go to the urgent care, they're going to evaluate you. They're wonderful providers over there and they know what they're doing. But say you forget to tell them that you're allergic to penicillin and you have a history of having a really bad reaction to penicillin in the past. Well, for a lot of for a lot of sore throats like strep throat, penicillin is still considered the first line antibiotic. So it is going to be very appropriately prescribed to you, most likely, if you go to an urgent care. And that provider is doing what is standard of care, is doing absolutely everything right, except they didn't catch or they weren't told that you have that penicillin allergy. And heaven forbid you take that antibiotic thinking nothing of it and you get a pretty bad reaction, or heaven forbid, something even worse. So you want to be treated by somebody who knows, hey, this person has a penicillin allergy. I have to treat them with an alternative antibiotic or an alternative treatment plan altogether. So that's just one example of how going to places other than your PCP, somebody who really knows your health, can increase your risk of coming across medical errors that are unintentional. Now, that's not to say that urgent cares aren't a good place to go or telemedicine isn't a good utilization of healthcare. They're very appropriate for when they're needed, because there are times when your PCP may actually tell you to go to the urgent care because they are not able to support the symptoms that you're having in their clinic or in their office. Say you have the flu and you're very dehydrated. This happened to me actually a few years ago. You know you're dehydrated, or your PCP suspects that you're dehydrated and you need treatment, and that treatment involves IV fluids. You're not that bad where you need to go to the emergency room, so you would go to an urgent care, they would evaluate you, and if appropriate, they would administer those IV fluids to get you back up and running in no time. And then for telemedicine, telemedicine has been a great, great invention as far as caring for patients and continuing to care for patients, because there are times when patients cannot come into the office or when physicians can't go to the office either for whatever reason. Maybe there was a pandemic, or maybe it's the middle of the night, or it's on a weekend. Whatever the case may be, if the patient and or the physician aren't able to actually go to the clinic, the other option is telemedicine. And it's so easy to do because nowadays most of us have smartphones, laptops, or iPad, tablets, and we can easily connect on a face-to-face call with our physician and get the care that we need. Now, not all issues and conditions can be treated through telemedicine, which is very important to know, but it's a great way to at least touch base with your doctor so you can get navigation of where to go next or what we need to do to get you back and healthy again. I hope that helped to answer your question. And our next one comes to us from Claude. And Claude writes to us through YouTube asking, hello, Dr. Kaur. I just turned 70 and I have a great primary care physician, but my buddy thinks I should start looking for a geriatrician. Do I really need to? Firstly, happy birthday, Claude. That's amazing. I hope you are strong and healthy. And thank you for sending in your question. It's a good one. Primary care physicians are highly skilled and trained to treat patients of all ages. So, in our residency training, we treat patients newborn to casket. Kind of odd to say, but it is true. So we run the gamut, the entire spectrum. That's what our training includes. Geriatricians focus on the care of the elderly individuals and elderly patients, especially because as we age, there's a lot of changes that our bodies undergo naturally, not because there's something wrong with them, just because we've aged and things aren't as optimal as they were in our 20s or in our teens. However, not everybody who is elderly needs a geriatrician. And I'll give you an example. I have a patient in my clinic who is a 90-year-old woman, and she is so wonderfully, knock on wood, she's healthy, she is sprightly, she's on minimal medications, and she's doing really well for her age for the most part, physically and mentally. But then I have a patient who's in her early 60s. Now, this patient is doing very well. However, she does have a complex history of medical conditions. She has several medical conditions that interact with each other and really need oversight and management. And that's done not only by me as her primary care physician, but me coordinating with all her specialists. Her situation is a little bit different than my 90-year-old patient. My 90-year-old patient, I would not recommend to go to a geriatrician. She's healthy, she's doing well, and there's really no need for an additional consultant or an additional investigation just because she's 90 years old. However, my 60-year-old patient, on the other hand, she would benefit from a geriatrician. And in fact, I just sent her to one last week, so this question is so timely. And the reason I sent my patient to a geriatrician is not just because she's in her 60s, but it's because since she has all those medical conditions, excuse me, she's also on a lot of medications, and those medications have the potential of interacting with one another. Now, as we age, especially after the age of 60, certain medications can have different effects than they did when we were younger. Some of them might be more stronger, some of them might not work as well. Some of them might have a higher risk of interacting with each other or with some vitamins that usually are taken. So that really needs to be looked at and it really needs to be evaluated comprehensively. And this is best done by a geriatrician. This is definitely part of their wheelhouse. So I had my patient go see a geriatrician as a consultant. If you do see a geriatrician, you will generally have two options. You can certainly switch your entire primary care to the geriatrician if that is appropriate for you and your health conditions, or you can just see them as a consultant like you would for any other specialist, like a cardiologist or a dermatologist. So my particular patient sat down with the geriatrician. They went through all her medications, and the geriatrician came back to me with her recommendations on why certain medications might be adjusted for her benefit and to minimize the risk of serious side effects like low blood sugar or low blood pressure. So, as you can see, different situations require different approaches for each person. You really should talk to your doctor, your primary care physician, and ask them, would I benefit from seeing a geriatrician? And together, you guys can make that decision and see what's going to be the best for your health moving forward. I hope that helped to answer your question. All right, folks, in case you missed it the first time, here's how you can send us your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, our next question comes to us through Instagram, and this is sent in by Zahara. Thank you for sending in this question, Zahara. And she's asking, greetings, Dr. Kaur. Money is a little tight right now. I'd like to know if having a primary care physician actually saves money. Excellent question. And big old yes. And I'll go into why I said big old yes on that one. Think about it this way. You wake up one day not feeling well, but you don't have a PCP and you can't just call them and say, hey, doc, or text them, I'm not feeling well. What should I do? So instead, you decide to go to the urgent care or even the emergency room if there's one near you and get evaluated and see what's going on with that sore throat of yours. Now, if this is something life-threatening like a heart attack, then absolutely going to the emergency room is absolutely the right thing to do. But if your symptoms are mild, like a sore throat or a little bit of a belly ache, then going to the emergency room, sure, it'll get you the evaluation that you need, but it's also going to subject you to higher costs Those emergency room bills, as we all know, can get quite high. And if you go in there for a sore throat or a bellyache, it may not justify what is actually going on. And same thing for urgent cares. Urgent cares are, yes, more cost effective than ERs are, but they're not more cost effective than your primary care physician, especially as I mentioned earlier, if it's somebody who knows you well and knows how to treat you the best and really get you healthy quickly. I hope that helped to answer that question. Let's get to the next one. This one is from Belle, and she's reaching out to us from Facebook asking, Hi, Dr. Kaur. I'm just out of college, into my first job and ready to find a primary care doctor. But what should I look for when choosing one? This is a great question, and I'm glad you're being proactive in establishing care with a primary care physician now so that that's going to ensure long term health and medical surveillance for you moving forward. Let's go over a few key factors that you want to look out for when choosing a primary care physician. Location. Everybody always says location, location, location. So, of course, location and convenience. You want to choose a primary care physician that's fairly easy for you to get to. Now, I know there are some individuals who will drive a long way to see their patients. I have one who drives from an hour away to come see me. So, it's always going to be up to you how far you want to go, but location and convenience. How often are they offering you appointments or able to offer you appointments? That's something that's very important as well. Hospital affiliations. Is your physician one that rounds in the hospital as well? And if so, which hospitals are they going to? And are those convenient for you? Heaven forbid you need to have care done in a hospital. Next, board certification and credentials. This is ever so important. When you are choosing a primary care physician, you want to ensure that they are board certified, that they are licensed in the state that you're choosing them in and that you're receiving your care in, and that they're credentialed from a validated medical school. And this is pretty easy to find out if you just type into Google or your preferred search engine medical license lookup. Let's say it's for Florida, then you do medical license lookups, state Florida Board of Medicine, and they always have links in there where the public can go and verify a physician's or a practitioner's license. So, for instance, if you go in and put my name, you will see that I'm licensed in Florida, and then it will show you if I'm board certified, what I'm board certified in, where my practice location is, all that wonderful legal stuff. So that's the first place that you want to look that up. There's other websites, but the Florida State Board of Medicine is going to be your first place to look. Insurance coverage and network. Of course, this is so important. When you have insurance, if you have insurance, you're probably paying a monthly premium for that. So you want to reap those benefits. And primary care is a huge part of that. So what you can do is call your insurance company and ask them for a list of local primary care physicians that are in network with them, so you can start by choosing down that list. Of course, you can also cold call a lot of primary care physician offices and ask them personally, hey, do you take so and so insurance? Are you in network, et cetera, et cetera. Communication style and bedside manner. I think this one actually should be number one because, as I mentioned earlier, you want a physician with whom you are comfortable. You can sit down and chit chat with them about, fun stuff, life stuff, but also the serious stuff because really that's what we're here for, is to help you when things get serious, if they get serious. And how is your physician talking to you? Is your physician giving you time to talk instead of just talking, 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 which I know is what I'm doing right now, but that's because I don't have anybody else to talk to. But when you're sitting with your physician, you want to make sure that it's a good back and forth rapport. Your physician is listening to you. You want to feel heard. You don't want to feel rushed. You don't want to feel like I didn't get to ask this question or that question. And bedside manner. Is the physician reciprocating? Is the physician interested in what you have to say? Is the physician acknowledging your concerns and saying, hey, this is what's going on. I'm sorry you're feeling this way. Let's look into it and see what we can do to get you feeling better. So important. Office hours and aftercare. That's also important because majority of us live a 9 to 5 kind of life. So we want to know, what are the hours that our physician's office is open? Is it accessible to me? And what happens if, at 7 o'clock at night, I'm having a sort of emergency, or I have that sore throat come up and I want to talk to my doctor or somebody at my doctor's office. So you want to make sure that you're clear on those logistics as well. And then specialization. Now, for the most part, primary care physicians are either family medicine, as I am, and we are trained to treat individuals from birth to the grave, And then there's internal medicine physicians who are trained to treat adults. And there's also pediatricians. Pediatricians are considered a sector of primary care physician, as are gynecologists in some places. But for the most part, we're talking about the big two. So primary care and internal medicine. Now, a lot of internal medicine and primary care physicians have done additional certifications. Some physicians have gotten certifications and specialize in functional medicine or lifestyle medicine or different types of preventative medicine. So it's really important to look up, what does the physician that I'm choosing specialize in, if anything, and is this something that fits and aligns with my healthcare goals and how I want to be treated for my health. All that being said, like I said, the first and foremost thing that you should be looking for is somebody who you can have a comfortable conversation with. You don't feel rushed and you don't feel ignored when you're visiting him or her. I hope that gives you some good advice and good luck on your search. I hope you find somebody who's a perfect fit for you. All right, let's get to our next question. This one comes to us from Marcello, and Marcello asks, "Hi, Doc. What are some of the most common conditions that primary care physicians catch early?" This is a wonderful question. As I mentioned earlier, the best treatment is prevention, or catching disease really, really, really early so we can nip it in the bud, so to say. So before I get more into it, let's watch this video from our friends at the Mayo Clinic.
When it comes to making the most of your visit to your healthcare professional's office, details about your health are critical. Dr. Ashley Pena, a Mayo Clinic neurologist, says consider bringing a friend or family member to your appointment.
They may be able to provide insights that are very helpful to your doctor.
Make a timeline of important events. When did a symptom first appear? Have you taken any medications? If so, how did your body respond? Dr. Pena says your visit should not be the first time your care team hears about certain topics. Do not wait to describe new developments in your condition or ask questions about medications.
Those are best answered by writing your doctor over an electronic medical record portal, if your doctor has one, or by calling into their care team.
When communicating, another tip is to use plain language.
It's best to talk to your doctor just like you're talking to a family member or a friend. Don't feel like you need to use medical terminology or understand medical terminology to make it through your visit.
For the Mayo Clinic News Network, I'm Alex Ositis.
That was very informative, and I agree wholeheartedly with what Dr. Pena was saying. Don't expect that you should be the one talking in medical jargon or knowing what's going on with your health, because as primary care physicians, we do not expect that. We are here to do that for you. All we want to know is what's actually going on with you, and writing the things down in a timeline is a great way to help us with our investigation. Now, some of the chronic conditions that primary care physicians prefer to catch early and hopefully catch early are things like heart disease, high blood pressure, autoimmune disease, diabetes. A lot of times these conditions they interact or they occur at the same time in the same individual. So when one comes up, we're usually already starting to look for the other one as well. Now, the other part of primary care physicians and the care that you receive from them that I think is very important to know is your preventative health and your cancer screenings. Depending on your age and your gender, there are certain cancer screenings and preventative health issues that should come up with your primary care physician. For instance, doing your mammogram for breast cancer screening, doing your colonoscopy for colon cancer screening, checking labs to make sure that you're not diabetic, especially if you're somebody who's high risk, making sure that your blood pressure is well controlled in the office and at home. And if you have any history of diseases in the family, that's going to up the ante on what we want to do to prevent it for you, but also to screen it for you. So say you're somebody who has a large history of autoimmune disease in the family. Maybe your mom had it, your sister has it, your grandmother has it. When something like that comes up, then our flags go up. We're a little bit more vigilant, and we know that for this person, we're going to have to be a little bit more on top of things when it comes to screening for autoimmune conditions or that particular disease that they may have. The other part of prevention comes in, what is your life like and what are you doing to help prevent disease? And I don't mean to put the entire onus of that on the patient, but what's your lifestyle like? Do you eat healthy? Do you exercise? Are you getting enough sleep? Are you not very stressed on a normal basis? What are your social relationships like? All of that really matters, and it really impacts your disease positively if you're doing it well, and negatively, really negatively, if you're not doing it so well. So that's one thing that you really, really want to keep in mind. All right, guys, I know that you've got questions. We've got the answers. In case you missed it the first time, here's how you can send us those questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So, as you can see, primary care physicians are really the center of the wheelhouse of your medical team. Whether or not you have specialists, it's important to have that PCP so they know you, they know your health care, and they can help you catch disease and prevent it early on because that's the best way to stay healthy. Of course, we want people to live long, but we want you to live happy and healthy as well. We don't want disease to burden your life and impact your quality of life negatively either. When you're looking for a PCP, it's okay to shop around. I would like a better way of saying that, but maybe go to a different PCP or a couple different ones, chit chat with them and see how you feel because that connection, that bedside manner, it is ever so important. All right, folks, thanks again for sending us your questions. I had a wonderful time answering them, and I hope that I answered some of them good for you and gave you some good information. Stay happy, stay healthy. I'll see you here next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Funding for this program was brought to you by Michael J. Zinner, MD,